Human expectations act as an invisible yet omnipresent force shaping physiological health, emotional well-being, and overall productivity. While individuals often assume their bodily reactions, such as susceptibility to illness, athletic recovery, or responses to stress and sleep deprivation, are objective physical facts, scientific evidence reveals that underlying beliefs directly alter biological reality. A landmark study from Harvard University, conducted by Alia Crum and Ellen Langer, highlights this mind-body connection. Researchers studied hotel room attendants whose daily duties involved strenuous physical labor, such as vacuuming, changing linens, and moving heavy furniture. Despite this exertion, the cleaners did not perceive their daily work as exercise. The researchers provided one group of cleaners with a brief intervention, explaining that their routine daily tasks met or exceeded the Surgeon General's recommendations for a healthy, active lifestyle. 1 month later, without any change in their physical habits or diet, the informed cleaners demonstrated measurable physiological improvements, including weight loss, reduced blood pressure, and lower body fat percentages, simply altering their mental framework regarding their daily labor triggered tangible health benefits. Conversely, negative expectations can exert destructive physiological effects. In the late 1970s, public health officials tracked a mysterious condition known as sudden unexpected nocturnal death syndrome, SUNDN, among young, healthy Laotian Hmong refugees in the United States. Anthropologist Shelley Adler discovered that the deaths were driven by a fatal convergence of cultural trauma and expectation. In Hmong tradition, an evil nocturnal demon called the Dab Sog smothers sleep paralysis victims. Resettled in America without traditional shamans or ancestral rituals to ward off the spirit, the refugees experienced intense guilt and terror during episodes of sleep paralysis. This psychological horror triggered severe panic, inducing massive cardiac arrhythmias that proved fatal. These phenomena are not rooted in supernatural forces or pseudoscience, like the law of attraction. Unlike unproven self-help claims, genuine expectation effects are grounded in peer-reviewed scientific studies and well-understood neurobiological pathways involving the nervous, endocrine, and immune systems. Chapter 1. The Prediction Machine. How Perception Shapes Reality. In December 2018, London's Gatwick Airport was shut down for over 30 hours following more than 170 reported sightings of unauthorized drones flying near the runways. The shutdown disrupted over 140 zero-zen travelers and cost millions of dollars. However, police investigations, military tracking technology, and extensive camera footage yielded zero physical evidence or photographs of any actual drones. Heightened public anxiety surrounding potential terrorist attacks, combined with visual ambiguity in the winter sky, led dozens of independent honest witnesses to hallucinate unmanned aircraft. This event illustrates a fundamental principle of modern neuroscience. The human brain functions as a prediction machine. Rather than acting as a passive camera recording external reality, the brain constantly constructs a simulated model of the world based on past experiences, context, and immediate expectations. In the 19th century, German polymath Hermann von Helmholtz observed that the light patterns hitting the two-dimensional retina are inherently messy, flattened, and ambiguous. He proposed that the visual system relies on unconscious inference, using prior knowledge to infer the most probable reality behind sensory inputs. Contemporary neuroimaging confirms Helmholtz's model. Within the brain's visual cortex, top-down neural connections carrying predictive signals from the frontal regions outnumber the bottom-up signals coming directly from the eyes. Neuroscientist Moshe Bar notes that humans see what the brain predicts rather than an unfiltered feed of objective reality. This predictive processing helps the brain conserve computational energy by focusing primarily on unexpected sensory details. However, when context or expectations are strong, the brain can radically alter conscious perception. Looking at ambiguous, high-contrast black and white visual noise may yield no recognizable shapes until a verbal prompt, such as a cow or a dog, is supplied. Once the brain updates its predictive model, the image becomes immediately obvious and permanently recognizable. In a Swiss study, 90% of zoo visitors tested in October saw an ambiguous visual illusion as a bird looking left. Around Easter, however, nearly 100% of young children saw the exact same drawing as a rabbit looking right, demonstrating how environmental relevance biases sensory interpretations. When Dutch students listened to pure white noise, while expecting to hear a faint recording of Bing Crosby's White Christmas, nearly 1/3 reported clearly hearing the song. Stress and caffeine intake elevated the confidence of these top-down predictions, increasing auditory hallucinations. Polar explorers enduring featureless landscapes frequently mistake mundane objects such as frozen dog droppings for distant human figures due to acute fears of competitors. Similar predictive errors explain sightings of religious figures in fires or ghostly voices in radio static. Predictive processing extends directly to clinical and psychological conditions. Patients suffering from functional neurological disorder, FND, can experience genuine blindness, paralysis, or numbness, despite having anatomically healthy sensory organs and nerves. In the case of a teenager named Sarah, severe photophobia from chronic migraines led her brain to construct an expectation that sensory light input was impossible, effectively lowering the shutters over her visual system. Neurologist John Stone successfully treated Sarah by using non-invasive electromagnetic brain stimulation to show her visual cortex was still functional, gradually updating her top-down expectations until her eyesight fully returned. Predictive biases also create micro-illusions that exacerbate daily anxieties. Individuals afraid of heights overestimate vertical distances from balconies by several feet, while individuals with spider phobias perceive arachnids as physically larger and faster than they actually are. Lonely or socially anxious individuals interpret neutral facial expressions as hostile and spend significantly more time focusing on cues of rejection, reinforcing their isolation through a self-fulfilling perceptual loop. Tools such as exposure therapy in virtual reality or cognitive bias modification games, such as the Personal Zen application, retrain visual attention away from threat cues, helping to recalibrate the brain's predictive models. The culinary and sensory worlds are similarly governed by predictive framing. Nutritional shakes labeled space food were rated as delicious compared to identical unlabeled shakes. In an experiment at MIT, 60% of pub patrons preferred a beer containing drops of balsamic vinegar, MIT brew, over standard beer, provided they were not told about the vinegar beforehand. Revealing the ingredient prior to tasting halved its popularity, as negative expectations altered the sensory perception of taste. Identical chemical aromas are experienced as delicious when labeled Parmesan cheese, but provoke nausea when labeled vomit. Sensory acuity itself can be supercharged through expectation. In controlled experiments, participants wearing generic sunglasses or headphones performed significantly better on visual and hearing acuity tests when told the equipment was made by high-end brands like Ray-Ban or 3M. In a study by Ellen Langer, MIT ROTC cadets placed in a flight simulator demonstrated a 40% improvement in visual acuity when instructed to act like real fighter pilots, showing that psychological framing can sharpen perception beyond baseline limits. Chapter 2. A Pious Fraud. The Neurobiology of Placebo Healing. The historical foundation of placebos rests on what Thomas Jefferson termed a pious fraud. The medical practice of administering inert substances like sugar pills, saline injections, or colored water to bring comfort without using dangerous, toxic treatments. While 19th century medicine often dismissed placebo responders as unintelligent or hysterical, modern neuroscience demonstrates that positive expectations produce objective, biological healing through physiological mechanisms. The modern study of placebos expanded significantly during World War II through the observations of military anesthetist Henry Beecher. Treating severely wounded soldiers in Italy, Beecher observed that nearly 3/4 of men with traumatic injuries refused morphine or reported minimal pain, comforted by the realization that their wounds meant survival and evacuation from the battlefield. When morphine supplies ran out, Beecher's nurses injected soldiers with plain saline solution, while assuring them it was a potent painkiller. The saline placebo proved 90% as effective as real morphine and prevented surgical shock, establishing that mental expectation triggers internal physiological healing. Beecher's work led to the adoption of the placebo-controlled randomized clinical trial as the standard for medical validation. Decades of trial data reveal the profound biological scope of placebo responses. Placebo pain relief is driven by the brain's release of endorphins and natural opioids. When researchers administer the opioid-blocking drug naloxone alongside a placebo painkiller, the placebo relief is completely negated, proving the effect relies on measurable biochemistry. In patients with Parkinson's disease, taking a placebo pill causes a rapid surge of dopamine in the striatum, improving motor control and reducing muscle tremors by 20% to 30%. Dummy inhalers deliver up to 30% of the bronchodilation benefits seen with real asthma drugs like salmeterol, while placebo anti-allergy creams measurably reduce histamine-driven skin inflammation. In a clinical trial published in The Lancet, patients suffering from severe angina underwent either real arterial stent placement or a sham surgery, where a catheter was inserted without placing a stent. Both groups showed identical improvements in treadmill exercise capacity, indicating that much of the surgical benefit stemmed from the patient's expectation of repair. Across multiple clinical trials, participants who consistently take their assigned dummy pills on schedule experience half the mortality rate of trial participants who take their placebos haphazardly, even after controlling for broader lifestyle factors. The ritual of taking medication acts as a recurring stimulus that promotes health maintenance. The strength of a placebo response depends on explicit environmental and psychological cues. 2 placebo pills work better than 1. Large pills outperform small ones. Colorful capsules beat white tablets. Injections outpace oral pills. And sham surgeries produce the strongest responses of all. High prices. Prestigious brand names such as Nurofen versus generic ibuprofen packaging, and warm, empathetic bedside manner from a healthcare provider significantly amplify the body's internal healing response. Interestingly, placebo responses in American clinical trials have grown significantly stronger over recent decades, causing many promising drugs to fail trial benchmarks. Researcher Gary Bennett attributes this to direct-to-consumer pharmaceutical advertising and increased media coverage surrounding the mind-body connection, which heightens public confidence in medical treatments. This shift has enabled the development of honest or open-label placebos, where patients are explicitly told they are receiving an inert, non-active pill. In a study by Claudia Carvalho, chronic back pain sufferers given clearly labeled placebo pills, combined with a brief explanation of how conditioning and expectations influence the brain's a 30% reduction in pain and disability, a benefit that persisted 5 years after the trial. In rehabilitation studies for spinal cord injuries led by Leon Morales Quezada, pairing an open-label placebo and a distinct aroma, cardamom oil, with reduced drug doses allowed patients to cut their opioid consumption by 66% without experiencing increased pain. Medical practitioners can also tap into expectation effects without using dummy pills. In the SciHeart trial, heart bypass patients in Germany received brief pre-surgery consultations to set realistic recovery milestones, address irrational anxieties, and visualize post-operative life. These patients were discharged from the hospital an average of 4.7 days earlier than standard care patients and showed significantly lower systemic inflammation, interleukin-6, 6 months post-surgery. Patients receiving iron infusions for severe anemia reported significantly lower day-to-day fatigue when shown simple visual charts illustrating how the infusion would restore their systemic oxygen capacity. Patients suffering from the common cold recovered an average of 1 full day faster when treated by an empathetic physician who explicitly reassures them that their symptoms will pass quickly. Expectation can also govern the timing of life's final boundary. Historical records show that mortality rates briefly dip right before major personal or cultural milestones and spike immediately afterward, a phenomenon known in Mexico as muerte hermosa. The deaths of former U.S. Presidents Thomas Jefferson and John Adams on July 4, 1826, the exact 50th anniversary of the Declaration of Independence, illustrate how a strong desire to reach a landmark occasion can help sustain physiological function until the goal is achieved. Chapter 3. Do no harm. The science of nocebo and threat perception. Just as positive expectations heal, negative expectations can harm. The nocebo effect occurs when a person anticipates sickness, pain, or physical decline, leading the brain to construct real physiological symptoms. Extreme manifestations include voodoo death, aboriginal bone-pointing rituals, and cases where misdiagnosed cancer patients rapidly deteriorate and die from the sheer expectation of terminal illness, despite autopsies revealing their tumors were benign or non-lethal. In the 1880s, physician John Noland Mackenzie conducted an early demonstration of the nocebo effect on a woman who suffered severe asthma attacks when exposed to roses. Mackenzie presented her with an artificial, fully sterile cloth rose. Within a minute of seeing the fake flower, the woman suffered a full-blown asthmatic episode, featuring hoarseness, nasal congestion, and acute inflammation in her throat. Her internal expectation of an allergic reaction triggered a physical immune response. Modern clinical data shows that nocebo responses are widespread in medical care. In an analysis of over 1,200 placebo-controlled trials, approximately half of all participants taking completely inert dummy pills reported unpleasant side effects, such as nausea, headaches, dizziness, and fatigue. 5% of placebo recipients dropped out of clinical trials entirely due to adverse reactions caused by reading side effect warnings. In a study of men taking finasteride for enlarged prostates, explicitly warning one group about potential erectile dysfunction increased the incidence of sexual side effects from 10% to 30%. Angina patients warned about potential gastrointestinal side effects from aspirin were 6 times more likely to stop taking their medication due to stomach pain than unwarned patients taking the same dose. Informing a patient that a needle stick will feel like a bee sting significantly increases their perceived pain and elevates stress hormones compared to reassuring language. At a biochemical level, the nocebo effect acts as an inverted mirror image of the placebo response. Anticipating pain deactivates endogenous opioids and dopamine while triggering the release of cholecystokinin, CCK, a peptide that actively amplifies pain signaling along the spinal cord. Negative expectations also provoke systemic inflammation, blood pressure spikes, and digestive distress. The power of public perception to drive nocebo effects was clearly demonstrated in New Zealand in 2007, when a pharmaceutical company changed the binding ingredients and color of the thyroid drug L-troxin from yellow to white. The active chemical remained completely identical. However, lack of clear public communication sparked media rumors that the new white pills were cheap, inferior substitutes. Over the following 18 months, reports of side effects surged by 2,000-fold across the country, driven entirely by psychological anxiety and public expectation. Broader beliefs regarding illness also dictate recovery timelines. A patient's initial beliefs regarding their prognosis predict their likelihood of developing lingering post-concussion symptoms with 80% accuracy, outperforming objective physical measurements of the initial impact severity. In the long-running Framingham heart study, women who believed they were particularly prone to heart disease were 7 times more likely to die of a fatal cardiac arrest over a 20-year period than women with similar physical risk factors who held neutral or positive expectations. To prevent nocebo effects, healthcare systems are exploring innovative strategies. One approach is personalized informed consent, where patients decide in advance how much detail they wish to receive regarding rare side effects. Another technique is positive informational reframing. In clinical studies, changing a side effect warning from 27 out of 100 people will experience drowsiness to 73 out of 100 people will not experience drowsiness, significantly reduced the onset of fatigue among participants taking medication. Similarly, cognitive reappraisal allows individuals to reframe bodily symptoms constructively. In a trial at Stanford University's Mind and Body Lab, children undergoing oral immunotherapy for severe peanut allergies were taught to view mild side effects, such as mouth itching or stomach distress, not as dangerous allergic flare-ups, but as positive evidence that their immune system was strengthening, much like sore muscles after a workout. This mental shift reduced patient anxiety and drove higher production of IgG4 protective antibodies, improving overall treatment success. Finally, individuals suffering from acute or chronic pain can counteract catastrophic thinking patterns. Catastrophizing, ruminating that pain will never end or expecting the worst, acts like pouring gasoline on a fire by elevating CCK release and amplifying neurological pain signals. By learning to challenge alarmist thoughts and adopting reassuring phrases such as "my pain is in my brain" or "these sensations are real but temporary," patients can deactivate internal pain amplifiers. Cognitive behavioral therapy, focused on reappraisal, regularly achieves a 30% to 70% reduction in chronic pain severity, demonstrating that resetting expectations provides a practical path toward long-term recovery. Chapter 4. The Muscle Mindset. Unlocking physical fitness and endurance. Physical exhaustion feels like a hard biological wall, the absolute point where muscle fibers, lungs, and heart can no longer function. However, sports science reveals that perceived fatigue is primarily an emotion generated by the brain as a protective safety mechanism long before the body reaches actual physiological collapse. South African exercise physiologist Tim Noakes developed the central governor model to explain this dynamic. According to Noakes, the brain acts as an evolutionary safeguard, constantly monitoring core temperature, glycogen stores, and oxygenation. When exertion reaches intense levels, the brain creates uncomfortable sensations of pain and breathlessness to force the individual to slow down before physical damage occurs. Crucially, the central governor sets its threshold based heavily on psychological expectations. Research across athletic disciplines confirms that mental framing alters physical limitations. In a classic study by Gideon Ariel, competitive weightlifters were given inert sugar pills disguised as potent anabolic steroids. Believing they were taking performance-enhancing drugs, the athletes broke their personal best records, lifting significantly heavier weights within weeks. When informed that the pills were placebos, their performance gains vanished instantly. Cyclists racing in simulated high-altitude conditions performed markedly better when delivered ordinary atmospheric air, while being told it was oxygen-enriched air. Their hearts pumped more efficiently, and lactic acid buildup delayed, simply because the brain lowered its protective fatigue signaling. In a study led by Alia Crum and Thomas Rothkrantz, participants underwent genetic testing for genes related to exercise capacity and satiety. Regardless of their actual DNA, participants were randomly informed that they possessed either a high-performing or low-performing gene variant. Those told they had the poor endurance gene showed significantly decreased lung capacity, faster body heat generation, and higher subjective exhaustion during treadmill tests. Their physiological performance adapted to match the genetic label they were given. Athletes can recalibrate their central governor through deliberate cognitive strategies. Reframing physical discomfort means rather than interpreting burning muscles, a pounding heart, or heavy breathing as indicators of danger or weakness, elite endurance athletes reframe these sensations as positive signs that the body is expanding its physiological capacity and burning fuel efficiently. Motivational self-talk involves replacing internal complaints, such as "I can't keep this up," with instructional or encouraging phrases like "my lungs are supplying oxygen to my legs," which reduces perceived exertion scores on the Borg scale by 10% to 15%, extending time to exhaustion significantly. Visualization and priming involves mental imagery of smooth movement and power, which suppresses top-down threat signals and allows the neuromuscular system to recruit a higher percentage of motor units during maximal effort. Chapter 5. Mind over Milkshake. Appetite, digestion, and metabolism. Nutritional science traditionally treats a calorie as a simple unit of energy. Energy in versus energy out. However, the human digestive system and metabolic rate do not process food strictly according to its physical-chemical makeup. How the brain perceives a meal radically dictates physiological satiety, gut hormone production, and metabolic processing. In a landmark experiment conducted at Stanford University by Alia Crum, participants were invited to sample 2 different nutritional milkshakes on 2 separate occasions, spaced a week apart. In the first condition, labeled sensual indulgence, the shake was presented in luxurious, high-calorie packaging and described as a rich, decadent treat containing 620 calories. In the second condition, labeled Sensi Shake, the identical shake was packaged in plain, diet-focused containers and advertised as a low-fat, guilt-free option containing only 140 calories. In reality, both shakes were identical. Moderate 380-calorie drinks. Researchers tracked the blood levels of ghrelin, the primary hunger hormone produced by the stomach that signals appetite when high and fullness when low. When participants consumed the shake labeled indulgence, their ghrelin levels dropped steeply, indicating deep physiological satiety and signaling the brain that a heavy meal had been digested. However, when the exact same participants drank the shake labeled Sensi Shake, their ghrelin levels remained virtually flat, leaving them physiologically hungry and unsatisfied. The brain's expectation of caloric intake governed the biological endocrine response, proving that mindset alters gut biochemistry. This expectation effect extends to digestion and metabolic efficiency through the cephalic phase response, which is the body's preparatory biological reaction to anticipated food. Believing a meal is hearty and nutritious triggers the salivary glands, stomach, and pancreas to release higher quantities of digestive enzymes such as amylase and pepsin and gastric acids before food even reaches the stomach, enhancing absorption efficiency. Labeling healthy foods with indulgent, flavorful descriptors like savory roasted garlic carrots, rather than health-centric terms like low-fat carrots, increases actual consumption in school and restaurant cafeterias by up to 25%, while making consumers feel more satisfied with smaller overall portions. Dieters who perceive their eating plan as restrictive, severe, and punishing maintain higher baseline ghrelin levels and elevated cortisol, driving intense cravings and slowing down resting metabolic rate. Reframing healthy meals as luxurious, nutrient-dense nourishment helps preserve baseline metabolism and reduces binge-eating triggers. Chapter 6. Placebo Sleep. Rethinking Rest, Fatigue, and Mental Clarity. Insomnia and daytime fatigue are among the most widespread health complaints in modern society. While physical sleep duration is undeniable for long-term health, cognitive performance and daytime alertness are often dictated more by how well a person believes they slept than by objective sleep architecture. In an experiment conducted by Christina Dragonich and Christy Erdel at Colorado College, participants who complained of fatigue were hooked up to specialized brainwave monitoring equipment, which was actually fake. Researchers provided the participants with a bogus technical explanation, stating that the sensors measured REM sleep percentage, a crucial metric for cognitive recovery. Participants were then randomly divided into two groups, regardless of their actual sleep measurements. The high REM group was told they had achieved an above-average 16.2% REM sleep, predicting sharp mental performance. The low REM group was told they had achieved a below-average 9.1% REM sleep, predicting sluggish cognitive function. The results were striking. Participants told they had poor REM sleep performed significantly worse on complex cognitive tests, assessing processing speed and working memory. Conversely, participants told they had received high-quality sleep performed exceptionally well, outperforming their personal baselines. The simple belief that one was well-rested acted as a cognitive booster, while the belief that one was sleep-deprived induced mental slowness. This dynamic explains the clinical phenomenon known as sleep state misperception, or paradoxical insomnia. Many individuals who visit sleep clinics complaining of total insomnia spend 7 to 8 hours in verified deep sleep according to polysomnography equipment, yet awaken feeling completely exhausted because their brain's top-down prediction remains convinced they were awake all night. To break this loop and maximize daytime mental clarity, minimize sleep debt catastrophizing. Anxiety over losing 1 or 2 hours of sleep causes more cortisol release and cognitive impairment, than the actual physiological loss of sleep itself. Reminding oneself that the body is remarkably resilient and that resting quietly in bed provides substantial physical restoration, mitigates daytime performance drop-offs. Also, reframe morning grogginess. Natural sleep inertia, the 20 to 30-minute foggy transition period upon awakening, is often misinterpreted as evidence of a terrible night's rest. Treating morning grogginess as a temporary physiological warming-up period prevents setting negative expectations for the remainder of the day. Chapter 7. The Stress Paradox. Turning anxiety into performance. Modern culture treats stress as a toxic disease that damages the heart, impairs cognition, and causes premature aging. However, stress researcher Jeremy Jameson and Stanford psychologist Alia Crum have demonstrated that the physiological impact of stress depends heavily on whether an individual holds a stress is debilitating or a stress is enhancing mindset. When a person encounters a high-pressure situation, such as public speaking, a job interview, or a competitive exam, the body activates the sympathetic nervous system, releasing cortisol and adrenaline, boosting heart rate and redirecting blood flow to key organs. Depending on mental framing, the body enters one of two distinct physiological states. In the threat state, where stress is seen as debilitating, blood vessels constrict, blood pressure spikes, and cardiac output drops. Cortisol levels surge without balance, triggering inflammatory markers. Cognitively, this leads to impaired working memory, tunnel vision, and freezing under pressure. Over time, it causes chronic wear and tear on arteries and accelerates cellular aging. In the challenge state, where stress is seen as enhancing, blood vessels dilate, allowing the heart to pump significantly more blood and oxygen to the brain. High levels of DHEA, a neurosteroid, are released relative to cortisol, promoting neural growth. Cognitively, this results in accelerated information processing, heightened focus, and improved decision-making. Physically, it leads to faster physiological recovery and built-in psychological resilience. Jameson tested this concept on students preparing for the GRE exam. Prior to taking the practice test, one group was given a short reading explaining that physiological arousal, such as racing heart and sweaty palms, is an evolutionary adaptation designed to deliver maximum oxygen to the brain to help them perform at their peak. The students who adopted this stress is enhancing mindset achieved significantly higher scores on both the practice test and their actual GRE examinations months later. Salivary assays confirmed that their bodies produced a healthier ratio of DHEA to cortisol, shielding them from toxic stress damage. To shift from a threat state to a challenge state, acknowledge and reframe arousal. When feeling heart palpitations or nervousness before a major event, tell yourself that your body is preparing you for action, and that adrenaline is sharpening your focus and delivering energy to your brain. Also focus on resources over demands. Threat states occur when perceived demands outstrip perceived resources. Itemizing personal strengths, past preparation and recovery strategies balances the psychological equation, shifting the cardiovascular response into a healthy challenge mode. Chapter 8. Unlocking Willpower. Overcoming the myth of ego depletion. For decades, popular psychology held that willpower is a finite biological resource, a concept known as ego depletion, popularized by psychologist Roy Baumeister. According to this model, self-control acts like a muscle or a fuel tank that runs out of glucose after mental exertion, requiring rest or sugar to replenish. However, Stanford psychologist Carol Dweck and Swiss researcher Veronica Job challenged this dogma. They discovered that the ego depletion effect occurs only in individuals who believe that willpower is a limited resource. In extensive cross-cultural trials, participants were assessed on their beliefs regarding mental stamina. Those with a limited mindset believed that difficult mental tasks exhaust mental energy, requiring rest to recover. Those with a non-limited mindset believed that engaging in challenging mental tasks energizes the mind, unlocking deeper focus and cognitive momentum. When subjected to back-to-back demanding cognitive tests, such as resisting temptations followed by complex problem-solving, participants holding a non-limited mindset showed zero performance degradation. In fact, after completing a grueling mental task, individuals with a non-limited mindset frequently performed better on subsequent challenges, demonstrating that mental stamina is self-replenishing when expectations align. Modern neuroscience supports Dweck's findings. The brain consumes approximately 20% of the body's baseline energy, and completing a difficult mental task causes an imperceptible change in total blood glucose levels. The sensation of mental burnout is not a true biological fuel outage. It is a top-down motivational signal generated by the brain to evaluate whether continuing the current effort is worth the cost. By realizing that mental fatigue is a subjective threshold rather than a hard physical wall, individuals can reframe cognitive exertion as an enjoyable state of flow, maintaining high productivity without falling prey to premature exhaustion. Chapter 9. The Fountain of Youth, Perception, Longevity, and Aging. Aging is universally regarded as a process of physical decline, memory loss, and increasing frailty. However, groundbreaking research led by Becca Levy at Yale University reveals that negative societal stereotypes regarding getting older act as a slow-acting nocebo, accelerating physical decay and shortening lifespan. Levy tracked hundreds of individuals over 20 years in the Ohio longitudinal study of aging and retirement. Participants' baseline attitudes toward aging were evaluated using detailed psychological scales. The findings were extraordinary. Individuals who held positive perceptions of aging, viewing growing older as a time of wisdom, self-actualization, and vitality, lived an average of 7.5 years longer than those with negative decline-oriented views. This survival benefit was larger than the longevity gains associated with lowering blood pressure, reducing cholesterol, maintaining a healthy weight, or avoiding smoking. In long-term brain imaging studies tracking elderly participants carrying the ApoE4 gene variant, a major genetic risk factor for Alzheimer's disease, those with positive age mindsets were half as likely to develop the disease compared to ApoE4 carriers with negative age mindsets. Positive expectations appeared to shield the brain against the accumulation of amyloid plaques and neurofibrillary tangles. Older adults primed with positive age stereotypes displayed faster walking speeds, stronger grip strength, and superior balance recovery following illness, compared to peers conditioned with negative stereotypes of frailty. Negative age stereotypes accelerate decline by creating a self-fulfilling prophecy. Individuals who believe memory loss or weakness is inevitable stop engaging in mentally stimulating activities, cease strength training, and interpret minor physical aches as signs of terminal degradation, raising baseline cortisol and systemic inflammation. Reframing aging involves seeking out vibrant older role models, rejecting ageist cultural commentary, and viewing advancing years as an ongoing process of skill mastery, emotional maturity, and personal growth. Chapter 10. The Expectation Toolkit, Practical Strategies for Daily Life. To translate the neuroscience of expectation into practical daily habits, David Robson synthesizes the core findings into a systematic framework. First, reframe physiological signals. Do not treat physical sensations as absolute, immutable truths. Reframe heart palpitations before a presentation as a sign of physical readiness. Treat burning muscles during exercise as a sign of expanding capacity, and view minor pain or allergic reactions as normal immune system training. Second, practice open-label conditioning. Utilize sensory rituals to anchor desired states of mind, pairing a specific aroma such as peppermint or lavender, a warm beverage, or a distinct playlist with intense focus, relaxation, or pain management allows you to trigger those exact neurological responses on demand through learned association, even when using non-pharmacological tools. Third, eliminate nocebo language and catastrophizing. Audit internal self-talk and medical inquiries. Avoid reading endless lists of rare medication side effects unless necessary. Frame medical treatments around their success rates rather than failure possibilities. And stop describing routine mental tasks or busy schedules as exhausting, draining, or overwhelming. Fourth, harness environmental and contextual priming. Optimize surroundings to signal high quality and success. Package meals attractively. Wear clothes or use tools that make you feel capable. And surround yourself with social groups and environments that model high energy, resilience, and positive aging. Fifth, cultivate realistic optimism. Expectation management is not about blind positivity, ignoring real medical advice, or denying genuine physical illness. True expectation control sits at the intersection of rigorous scientific understanding and practical cognitive reframing, updating top-down predictions to eliminate unnecessary self-imposed barriers while allowing the body's natural physiological systems to operate at peak potential.